proper scoop.
7 is the time. The way the NHS looks after terminally ill patients has been in the spotlight lately, with many families complaining they've not been given enough information by medical staff.
Well, new rules for those who care for the dying will be announced by the government today, ensuring relatives will be consulted before a decision to withdraw food or water is taken. The proposals will also mean an end to mixed-sex wards for patients staying in hospital overnight. The Health Minister, Norman Lamb, joins us now from our Norwich studio. Very good morning to you. So these separate issues are part of proposed changes to the NHS Constitution. Tell us first, though, about the issue of end-of-life care, something which has been very controversial in the past few weeks. People talking about their own experiences of seeing relatives die as food and water withdrawn. How are you going to address those concerns?
Well, I think the concerns that we've heard expressed are often about patients and loved ones feeling that they haven't been sufficiently involved and informed and consulted about care. And at the end of life, it's as important as any other type of care. And so, I mean, first of all, the Liverpool Care Pathway, which is what the controversy has been about, actually requires as a crucial part of it that there should be absolute consultation and discussion and involvement of the patient if possible, but if that's not possible, then with loved ones, so that they feel that the experience of death, which of course is traumatic inevitably, but is as good as it can be. And actually the original model of the Liverpool Care Pathway was designed to bring hospice care, hospice-style care, into the hospital setting when a patient is dying in hospital. Of course, what we want to do as much as possible is to respect the patient's wishes about where they want to die, and the majority of patients want to die at home with their loved ones, and we want to try and respect that as much as we can.
Okay, if it is already a requirement that relatives are consulted, then what are you suggesting should be changed?
This is to reinforce that principle, and it's a principle that is reinforced across the whole of NHS care. So the Constitution, which sort of sets out the basic principles about the NHS and what patients should expect from it, will make clear in the future that you should always be involved, that consulted together with loved ones about the care you receive, but making a very let me just make this point, but making a very specific reference to end-of-life care, so that it makes it clear for everyone. The NHS Constitution is a document that anyone can get access to, can see, and every provider of healthcare within the NHS must have regard, must take account of the Constitution.
You have already acknowledged that there are families and relatives who have been extremely anxious because they haven't been consulted. If it is already a requirement and you are just reinforcing this by putting it in the Constitution, does it come with some sort of obligation on hospitals then that goes above and beyond what already exists? And how can relatives ensure, because something's going wrong if relatives are not being informed?
Well, the first thing is that I am deeply concerned when I hear stories about families not feeling that they've been involved, and instead I've called a round table for later this month, bringing doctors and patient representatives together to discuss where things might be going wrong, because, as I say, the central principle of the approach that should be taken is to centrally involve patients and their families in decisions at the end of life. But I think the importance of the Constitution is that it makes it very clear and explicit, and legally every provider of NHS care, whether it's in the public or the private sector, has to take account of the NHS Constitution. It's a legal obligation. They should all be following what it says, and it will now specifically refer to the importance of involvement. So I think it really does genuinely strengthen the obligation, and it sort of reinforces. This is a process that we've been going through over many years. I think overall the experience of death has improved quite a lot, with doctors much better trained than they ever used to be. But we have to keep on at this, and we should never be complacent. And when we hear these awful stories, we need to act on them.
Separately, you're going to address the issue of single-sex wards. Now, this is an issue, a perennial issue, and still doesn't seem to be happening. Now,
Well,
you're also addressing this in the Constitution, so when will this actually happen?
Well, you might not be aware, but in fact, over the last 2 years, there's been a dramatic improvement with a very substantial reduction in the number of patients who experience mixed accommodation. So we've made really significant progress, but again, it's making it clear in the Constitution that as a patient, you have the right to expect single-sex accommodation. So again, it's part of being very clear to patients about what they should expect.
You have the right to expect it, and what if you don't get it?
Well, ultimately, the commissioners, which is the doctors' groups, the clinical commissioning groups, which are there on behalf of patients, can challenge the provider of care that has breached this right. They can challenge them. Ultimately, there could be a legal challenge if a provider was sort of systematically failing to take account of the Constitution in this regard. So I think it provides much greater force, and again it restates the principle that you should have single-sex accommodation if you have NHS care.
Norman Lamb, Minister of State for
much.
Care and Support, thanks very much.
Thank you.
Time now is 7:15. Coming up on the programme today.